Good morning, everybody. As we suspected, New South Wales State PM last night had 97 cases of community transmission. Unfortunately, 29 of those, we understand, were infectious for all of the time that they were infectious in the community. And this is the number that is concerning. That number of people being infectious in the community keeps going up. And we really want to stress to everybody, please stay at home, follow the orders. In particular, unfortunately, the Fairfield local government area is still seeing around three quarters of all cases are in the Fairfield local government area, but we're also seeing an extension of cases in those adjoining suburbs and local government areas. So in particular, we ask everybody in that community to really make sure that they stay at home unless they absolutely have to. But can I in particular also thank members of the Fairfield local government area. Yesterday we saw 77,500 tests, which is outstanding, many of those from southwest Sydney. So thank you to community members there. Previously we had said that if you have the mildest of symptoms, you should get tested. Of course, we're asking any people who need to work outside of the house from that local government area to also get tested every 3 days. But now we're also asking that if you have anyone in your extended family, extended social circle or workplace that has the virus, go and get tested regardless. We are seeing cases where people don't have symptoms and yet they're carrying the virus and don't know it. So if you know anybody in your extended family, in your extended social contacts, in your extended workplace arrangements that has the virus, please make sure you go and get tested. And again, yesterday's testing numbers were outstanding. 77,500 people came forward, and we need to do more of that. As you know, we've increased our testing capacity throughout the Greater Sydney area, but in particular those local government areas. And there are now 24/7 test sites available. So please make sure you get that testing done. But in the main, we just need people to stop moving around. And whilst we know that southwestern Sydney has the bulk of the cases, it's really important for all of us, no matter where you live, no matter your circumstances, to stay at home, because we know how easily the virus spreads and we know how easily other communities can get that virus. On that point, Deputy Commissioner Warboys will stress the importance of people in Greater Sydney not trying to sneak out to the regions. The regions have done exceptionally well in not having the virus in regional New South Wales, and we've been able to keep them out of lockdown by making sure that they have restrictions, but obviously they don't have the same stay-at-home orders that others do. So Deputy Commissioner Warboys will talk about some police activity around that. We also know we have another weekend upon us, and many of you have been staying home and respecting the health orders, but we please ask that apart from that exercise that we've allowed outdoors, that people stay at home. They don't move around, don't go shopping, don't do anything unless you absolutely have to. This weekend will be finer weather, so please stay safe when you are exercising. Please stick to the rules so that all of us can be safe. I'll ask Dr. Kerry Chant to give her health update. Then Minister Hazzard and Deputy Commissioner Warboys will also provide updates. Thank you.
Yeah. So New South Wales recorded 97 locally acquired cases of COVID. The majority of these were household contacts of previously confirmed cases and other close contacts. We still have a number of cases under investigation, and we are seeing the emergence of unlinked cases, which is a matter for concern. Clearly, the fact that 29 cases were infectious for 2 or more days in the community is incredibly concerning. And I can't stress to the community my absolute concern that we need to work harder at reducing mobility and reduce our interactions with others if we're going to bring this situation under control and see a decline in cases infectious in the community. Can I thank the community of southwestern Sydney and in particular Fairfield? I've had the privilege of working in that neck of the woods for a long lot of my life, working life, and it was an amazing place to work and live. So can I just say a big thank you to the community. I appreciate that we've had over 77,587 tests, and I suspect that's large due to the turnout for testing in people that reside in that local government area. One of the other points I'd like to make is that whilst we are talking a lot about Fairfield local government area and the adjacent Liverpool local government area extending into Canterbury Bankstown local government area, we need to remember that the cases we're seeing today reflect transmission events 4 or 5 days ago up to 14 days ago. And so anywhere around you, you may have cases. So you just can't go on the basis of where I've told you is a hotspot today. That may be different next week. So just every time you leave the house this weekend, please consider that the person you may come in contact with has COVID. So wear a mask indoors. Make sure you're putting your mask on well before you enter indoors. If you're outdoors and you can't socially distance, put on a mask. And keep that social distancing as you're shopping and moving around for those absolutely critical things. My vision for this weekend is very much a stay at home. Do not leave the house unless it is absolutely critical to do so. The other areas of concern for increased testing are Bayside, Campbelltown, Camden, Lakemba, Fairfield, Liverpool, Cumberland, Mount Druitt, Rooty Hill, Bayside, Sutherland Shire, the Georges River area, and I just ask everyone to come out for testing if you've got the most minimal of symptoms. Also, we are seeing that people are sometimes delaying getting a test. So again, my message, please do not delay. This virus spreads so quickly that by the time you get tested, if you're leaving it for 2 or 3 days into that symptom onset, you've already impacted those most near and dear to you. So please get tested as soon as possible. And remember that we have also seen people go to chemist shops when they've had symptoms of COVID. Don't go to the chemist shop, get tested, and obviously if you need health care, ring up and try and get someone from outside your household to pick up any scripts or any other critical medications for you and drop it off in a no-touch environment. In terms of COVID cases in hospital, we have currently 75 COVID cases admitted to hospital with 18 people in intensive care, 5 of whom require ventilation. We've got 30 people admitted to the hospital at the moment with COVID, are under the age of 55, and of those, 11 are under the age of 35. We have 19 people in ICU, 1 in their 20s, 1 in their 30s, 2 in their 40s, 5 in their 50s, 5 in their 60s, and 3 in their 70s, and 1 in their 80s. And of the 17 people in intensive care, only 1 has received 1 dose of the AstraZeneca vaccine. Thank you.
Thank you, Dr. Chant, Minister, Premier. Good morning. 164 infringement notices issued in the last 24 hours, over 200 warnings and advice given to people about breaching the public health orders or getting close to breaching the public health orders to make sure they're aware of their obligations and their commitments. What I'd like to highlight today, though, is the 3 focuses that I see New South Wales Police will take over the next 72 hours from here on through to Monday. We've spoken a lot about people moving outside of Greater Sydney and trying to disguise that in some sort of business trip when it's really a holiday, trying to provide police with excuses as to why they're found outside of Greater Sydney and they have a caravan that they're towing or camping gear with them. Every single day, senior police from North Region, Southern Region and Western Region meet and discuss the tactics the police will use, the taskings that police will use. They review the last 24 hours and be rest assured they come up always with the same strategies, and that is about enforcing the major arterial roads out of the Greater Sydney area, making sure they're visible at regional airports, making sure police meet buses and trains that come out of Sydney, but also linking that with our Police Transport Command in and around Central and our police at the domestic terminal. If people want to travel outside of the Greater Sydney area, they will be stopped by police. If they're not stopped by police, the local communities will dob them in, and we encourage that. They will be investigated where appropriate, issued personal infringement notices, and they'll be returned or directed back to Sydney. Another focus that we will have is along the beaches and the parklands around the city beaches. Last night, we saw a young man with a van, some music equipment, pull up near the CBD of Manly down near South Stein and host what we would term was a pop-up party. When spoken to, that young man tried to convince police that it was some sort of marketing strategy or exercise strategy, when clearly it wasn't. The people who contacted police described it as a party in the street. That man was issued with an infringement notice despite that excuse that he used, and was asked not to continue with that behaviour over the weekend. The people of southwest Sydney need to be congratulated. Police have been welcomed with the increased presence in southwest Sydney and in particular in Fairfield, where the vast majority of people continue to do the right thing. Where we had those people queued up and some activity around those testing centres, the people of Fairfield in particular worked so well with police to make sure that that was calmed in a very quick space of time. And today we see a very structured environment around those testing centres, and we encourage people to come out and be tested, not just in southwest Sydney, not just in Fairfield, but anyone who has symptoms. The message is quite simple. Do not go to work, go and get tested and isolate. What we want to see people do over the next 72 hours is quite simply stay at home unless you have a very good reason to go out. We want you to work with police right across the state, but in particular, we congratulate the people of Fairfield, and we will continue to work with those people through the next few days. Thank you.
Premier,
Sorry, just 2 seconds. I just want to reflect on the fact that this virus obviously arrived in Sydney, in New South Wales, on the 25th of January last year. And during its life here in New South Wales, it has focused in different areas. Obviously, we remember very well the focuses in the eastern suburbs, focus in the northern beaches, but now it's varied itself, of course, into the Delta variant, and it's focused particularly, if you like, the epicentre is now the Fairfield local government area. It's not fair. It's a particularly infectious variant. I know just this morning, talking with our Chief Health Officer and her advisors, I was informed that at least one scientific paper says that this particular variant is almost 1,000 times more infectious than the previous variants. So the challenge that's being presented to the Fairfield local government area community is enormous. Dr. Chant worked in southwest Sydney. I worked in southwest Sydney for a number of years and was often in the areas in the Fairfield local government area. And the community there are a fantastic community. They are very family orientated, I just asked them to think about the fact that this Delta variant is just so problematic, to please exercise an enormous amount of caution and to get tested as often as you think you should, and then do it some more. The reality is that if you have any family, any friends, anywhere in the Fairfield local government area that have got this Delta variant, it would be helpful if you went and got tested. As the Premier said, we've put a lot more resources into Fairfield. We have a lot more nurses and medical staff there. They're very keen to help you. They're very keen to test you and to provide the information that you need and your family and friends need. Please don't hesitate. Please don't feel like, I got tested yesterday, I don't think I'll get tested today or tomorrow. You can do that. We have the resources to do it. It's very different from earlier in the pandemic when we were a little more cautious. But this variant has come at a time now when we have a lot more resources available. So please feel very, very prepared to go and be tested as often as you like. We are absolutely, the figures are showing us. The last week, we've seen the constant numbers in southwest Sydney. Up over 70% of all of our cases are happening in southwest Sydney. So that's where we need to be supportive, but we also need you, each and every one of you, who are a representative of an amazing and fantastic community who are doing such good work, to just be prepared to get tested as often as is possible for you. Don't hesitate. Thank you.
Minister from Queensland Health Minister now referring to this as the Sydney Delta strain.
Oh, look, I think it doesn't pay to be silly about this. I think the reality is that this is a virus that has spread across the world. It's killed more than 600,000 Americans, more than 4 million people. It's better that we respect the danger of the virus and not be drawn into those sorts of comparisons. I'm sorry if that's what's been said, but it's certainly not something that I, or I'm sure that anybody in New South Wales would be saying. It's a dangerous, dangerous variant, and it's there after all of us. We all need to take care.
Mr Latham this week expressed concern that judgment of yourself, even the Premier and Dr Champ, may be compromised because of fatigue that you'd naturally be under. He suggested perhaps we need some fresh eyes, that perhaps you, Premier, should take a break.
I'm sorry, who suggested that?
Mr Latham.
All right.
Is there room for you?
Look, I haven't actually taken.
For you to take a break for a moment?
I haven't taken an awful lot of notice of what Mr Latham has said when he swapped for various political parties and is an authority in all matters. But can I say this? I'd like to say that everyone in New South Wales, I think, is tired after 18 months of this horrible virus. I particularly want to acknowledge our health staff.
We're not making judgment calls.
Sorry, just let me finish, please. What did you say?
We're not the ones making the big calls.
Clinton, our health staff at the front line are making decisions every day, life and death decisions. And they're tired, but you know what? They're all very professional and we're all doing our job and we'll continue to do our job and we're very committed to doing our job. But our essential job is to make sure the community are with us on this journey, and we're working very hard. We work very hard to keep them safe, and they are working very hard. So I think that's what's important. So if I get drawn on Mr Latham or the Queensland or anybody else, we'll just keep working.
But with the fatigue that you're all under, though, should you actually take a break, take a month off?
As I said, we're all working to do what we need to do, and we'll continue to do that. But I think we know what our capacities are, and we're very keen to keep working and to look after the community. I think the community know that too. Thank you.
Sorry, if I could just ask quickly. We're not seeing a movement in the right direction with the numbers yet. Are you concerned that the current restrictions you have in Sydney right now are going to contain this outbreak, and why aren't we changing tack if it's not working?
Look, there's no doubt that the numbers aren't where we'd like them. I'm assuming because we had in the last 24 hours at least 29 of those 97 cases infectious in the community, that the numbers tomorrow will be greater than what we've seen today. Please know that every day on an hourly basis we receive ongoing reviews, or we make sure we review all the time the settings we have in place. If we need to go harder, of course we will, but we need to make sure that any measures that are put in place are going to hit the mark, are going to do the job we need them to do. Please know we review that every day. We've never ever been afraid of taking those difficult decisions to keep our community safe, and we won't hesitate to do that even further.
What are the hard options?
Well, this is again will be based on the health advice, but we know where the virus is concentrated. We know the type of situations where it's being transmitted, but the challenge we have is, as Dr. Chant said, what we're seeing today can be a reflection of what's occurred 2 weeks ago. So the data we've collected to date will give us good advice, good information on what we need to do. But please know, and can I make this send this really strong message to the people of our state, that we will not hesitate to take any decision we need to make sure those numbers go down. And those settings are reviewed on an ongoing basis, and the government will take action when we need to.
How close are we wearing masks being made mandatory outdoors? How close are we to that?
Well, look, again, what we need to do, what New South Wales has done is base our settings on the advice we've been given. And to date, we don't know of anybody who's transmitted or received or transmitted the virus whilst they're exercising, for example. However, we do know transmission has occurred in workplaces. And obviously, we know that the greatest number of transmissions are at the moment in households. So households and workplaces are where the transmission's occurring. But some of those workplaces are in health settings, in pharmacies, in supermarkets.
Any cases in those small retail?
Well, obviously, as I've said, the vast majority of the case. I'll ask Dr. Chant to answer that.
So sorry, and could I just actually say with the very clear health advice is that you have to wear masks outdoors when you can't socially distance. I'm really pleased to see the vast majority of you wearing masks, and that's what we absolutely need to do. To reinforce it again, if you're going up to takeaway, even if that's open out to the outdoors, you need to wear masks because you're not going to be able to control the movements of an individual. You can come into proximity, there can be crowding. So our mask order is to say when you are walking alone in the bush, in the free air, where you're not going to come into contact, you don't need to wear a mask. But my strongest advice, and if we need to reflect this in the health order, is if you're in a situation where you're coming in contact with anyone or likely to, then you need to have a mask. So any time that you leave the house, everyone should have a mask on them because they don't know when their plans might change along that walk. The other component is we clearly need to see a decreased mobility and a decreased range of interactions. And we need to also support the communities of southwestern Sydney with targeted responses to support them as well. So clearly my advice is that we need to do more to reduce that mobility and to reduce those interactions. In terms of the cases infectious in those shops, if you go to our website, you'll see that it largely reflects all of the exposure venues. So if you go to that website, you'll see when there are people infectious in those settings. When I've looked at it recently, they've largely been supermarkets.
Have there been specifically cases in both exposure and transmission in those smaller retail settings, in clothing stores, in boutiques that are still open? Have you seen any at all?
No, but I would have to go back to all the things, but from memory, that hasn't been a feature. However, the issue is we do want to have a decrease in mobility. So
then the reality is, I guess, the
less
question is
less
that
people
shutting it down,
less people
shutting down
moving,
retail
less,
wouldn't
less,
necessarily stop
less
transmission.
people moving around, and less is what we actually need to achieve. And clearly, that's what we need to reflect on. And that's clearly my advice, that we need to do more, both locally and also to decrease movement overall. What I'm concerned about, those issues are, we're providing updated advice to government all the time, which will be duly considered. The key issues that I just want to highlight to the community is we can't be complacent just because the cases are predominantly in southwestern Sydney. We're seeing them pop up in other local health districts and other local areas, and there is a lag in the data. So you absolutely have to be vigilant no matter where you are across New South Wales in general and Greater Sydney in specifically.
Premier, sorry, just the question is...
You need to do more. What more are you going to do?
Oh, look, we all think we need to do more, all of us collectively, and that's why government will continue to review the settings based on the health advice. And if Dr. Champ says to us there's further things we need to introduce to reduce mobility, of course we will do that. Please know we will not hesitate to do that. I know the sentiment that exists in Greater Sydney, including with all of us, is we want to end this lockdown as soon as we can. We don't want this to drag on, and we know the community wants us to do more, so long as that means the lockdown isn't extended for a longer period. And that's really our focus. What can we do now to reduce mobility, to make sure that the virus doesn't spread? But the challenge for us is to make sure any decisions we take moving forward are targeted. The worst thing we could do is put in additional measures which don't have the desired effect. That's why it's really important for us to focus on the data, the information that we get from our experts, to make sure that any additional measures we put in place are going to have the desired effect. The worst thing we could do was to bring in measures which didn't see those numbers go down. That is our absolute intent. There were yesterday, again, 29 cases infectious in the community. We need to get that as close to zero as possible before we can end the lockdown, and that's why we're focused on that. All of us have been working together, and I want to thank all communities for the way in which they've responded. And as Dr. Chan and Health Minister Hazzard have said, we've had different regions, different parts of New South Wales face the challenge of having the virus persist in their community. Unfortunately, at this stage, it is southwestern Sydney, and unfortunately, it's the highly contagious Delta strain. So we are continuing to work closely with the community, and thank you again to those communities who've really stepped up. All the community leadership, everybody's put all differences aside and come together to work together. That's what we'll continue to need to do. And please let me stress, we will not hesitate. We will not hesitate to go harder, but we need to make sure that any additional measures we put in place are going to have the desired effect and are well targeted, because otherwise we won't see those numbers go down. And that's why it's important for us to base it on the science and the data. And please know that Dr. Chan's team and overall other health advice in relation to the data is coming in all the time. And as soon as we make any decisions, we will of course convey that to the community.
Is it a reality that
Yesterday, Adam Marshall received a Pfizer shot and he's 35. People want to know how that's possible given the rule in New South Wales is 40. We understand doctors are going a bit rogue with it, giving the Pfizer to whoever they like. Are you comfortable with that, or is it rules are rules?
Oh, look, I'm not sure what the circumstances of that are. I was not aware of that until that situation. But please know that in relation to people's private health issues, GPs can recommend, depending on people's personal health conditions, about.
The doctor just said, I wanted to give Pfizer because I had a supply.
Look, I don't know anything about that. But just in general, please know this is the time to get vaccinated. Make sure you don't have symptoms. Make sure you're COVID-free. But as Dr. Chant has said, we encourage everybody who can to come forward and get vaccinated through our New South Wales health sites, or of course through the GP network. And I'm really pleased and want to thank the pharmacists for stepping up. Many of them will be able to offer AstraZeneca. And we know that the way out of this COVID situation we have across the nation is high rates of vaccination. And we're looking forward to the population responding as they have, but we're also looking forward to those extra doses, which we know will come towards the end of September.
There is a gentleman on TikTok who for the past 3 days has released the information about case numbers before you have. Are you concerned there's a compromise within New South Wales Health?
Oh, look, all we can do is focus on the job at hand. And I know at the moment a lot of people have or alleged to have various bits of information or bits of advice, and that's welcome. We're in a democracy. But what's important for us as a team, as Team New South Wales, is to focus on what's necessary, and that is to lead our state during its most challenging of times. And I can't stress that enough. But I'm also really proud of the way the community has come together to work on this. It has been a difficult situation, and I shudder to think what would have happened had we not gone into lockdown when we did, given the cases and how transmissible the virus is. And again, I want to stress, we will not hesitate to go harder, but any decisions we take have to be targeted, because if you don't take the right decisions, you can actually make things worse. What you need to do is make sure that any further restrictions take the numbers down and make sure that we keep the community strong together.
Dr. Chan, can we please get some clarity? Sorry, thank you. Can we please get some clarity as to how many healthcare workers are in isolation at the moment and what impact that's having on the system? And just while I've still got you there, we're hearing reports that as many as 70 close contacts are linked to the 3 paramedics that have tested positive. And we're also hearing that some staff at Campbelltown Hospital are also in isolation. Can you just give us a bit of clarity around that, please?
So there have been, sadly, a number of healthcare workers impacted by COVID. Pleasingly, many of them were vaccinated, and which will be afford them good protection against severe disease. We obviously, healthcare workers can get exposed both in their community life as well as in hospitals. We look at those exposures and the reasons for those acquisitions closely, and have extensively published that to be open and transparent. I am aware that there have been exposures in healthcare settings that have led to transmission, and as I said, but our staff do wear PPE, and we look at each of those cases very intensively to see if there's any lessons learnt about how we can better support our healthcare workers stay safe.
Do you have figures? Has there been 70 close contacts linked
there
to
would,
those paramedics?
I think, look, there would be a large number of healthcare workers that are actually...
Do we know how many of those have been linked to those paramedics in particular?
I can probably find out that information in my notes, but suffice it to say, I think rather than... I'm happy to give you that data later, but I think we need to say that when we have a healthcare worker exposure and an infectious healthcare worker, we obviously take a very precautionary approach. We do not want an outbreak in a healthcare setting, And so we identify very thoroughly all of the close contacts, and we take a very low threshold for identifying them as close contacts. And so it does impact a large number of staff, and I think we saw that in the Royal North Shore impacts earlier. We see that in aged care facilities as well.
Campbelltown Hospital, sorry, has there been transmission at Campbelltown Hospital? Can we confirm that?
I'll have to get the information about how the healthcare worker there acquired the infection, or whether they were just exposed to a positive case. Because again, if there's a positive case there, then they're contacts, not necessarily cases. Could I also just indicate one other call out to the community? I mentioned this yesterday, but I really particularly want to mention it again because we want to make sure that we can rapidly assess all of these individuals and prevent any further transmission in the community. So I mentioned that there was a work site at Belfrog Street in Greenacre called Hanson Concrete, Australia. There are 4 cases associated with this workplace, which is located next to D&M Ashfield, which has 9 cases associated with it. And just to highlight that because this exposure has been going on potentially from Thursday the 1st of July to Wednesday the 14th of July, we're also concerned that workers may have then passed it on to their households. So our immediate advice is anyone who worked at Hanson's and anyone who received a delivery from Hanson's, you and your household or other close contacts should immediately isolate and get tested, because what we're concerned about is ring fencing those rings of transmission. Sorry.
So, Deputy Commissioner, can you please just... Are you able to clarify and confirm whether a family member of a senior member of the New South Wales Cabinet has been fined for breaching travel restrictions?
Yeah, what I can say is that a young lady from down at Queanbeyan was spoken to by police from Queanbeyan Police Station. That young lady was considerate of the investigation, was polite and forthcoming, and an infringement notice was issued to her.
Minister, do you have an update on the situation at Westmead with the cleaners and the concerns that the HSU has around their access to full PPE?
Yeah. Look, I actually had a chat to both the management of the hospital and senior management in the ministry, but also I had a chat to the union as well last night. And I think what's happening is that obviously there's some difference of opinion, but I've indicated to the team last night that I'd like us to be being as generous and as reasonable and as understanding of our health workers and err on the side of being supportive to the nth degree. And I'm told that that's what's happening. They'll still have to resolve the issues at some point, but whatever they want, they will have at the present time. Yeah. I got to say, I said yesterday, and I got to say again, the cleaners last year, I think it was, for the first time there was actually international recognition of cleaners, and what a time for that, for us to be able to recognise the cleaners in our hospital system who and our aged care system who are there at the front line of what is a very difficult time. And I also want to thank the HSU and Gerard Hayes for the work that they've done supporting their cleaners. And anything the government can do, our government can do to support our cleaners who are doing an incredible job, we will do.
While you're there, Minister Hazzard,
Liz.
Anyone over 70 has had since March to get the jab. Is there any excuse for anyone who's over 70 to not have had at least one dose?
Yeah, there's lots of excuses. I'll let Dr. Chant answer the question in detail, but there are people who, for various medical reasons, may not have been able to have them. So, but certainly, the majority of 70-year-olds that I know are very keen to have the jab. In fact, I think everybody. The interesting thing about this, out of every challenge, there's a silver lining, and the one silver lining that's come out of this Delta variant causing us a degree of issues at the moment is that 5 weeks ago, 6 weeks ago, I think all of you were asking me questions about why we weren't getting people wanting to be vaccinated. Now they're lining up to be vaccinated. The challenge remains that we need more vaccine. And I know I've said before, the federal government did their best to try and get opportunities for vaccines much earlier on, but obviously it's taking a while to get them because the whole world's fighting over getting vaccine. But I don't think there's the same reluctance anymore, and I think by far the majority of 70-year-olds are very keen to get vaccinated, but I'd say almost everybody's keen to get vaccinated. But Dr. Tandy, you want to add anything to that?
Just again to reiterate the message about getting vaccinated, there are a limited number of contraindication. There are a limited number of reasons why an individual is advised not to, but that's actually a very small number of reasons. So I would urge everyone over 70, everyone over 60, everyone to consider the AstraZeneca vaccine and to take any opportunity to get vaccinated. As the Minister said, it is essential for us to live somewhat normally with this Delta virus and any other variant that we might get thrown at, that we are going to have to be highly vaccinated as a population, and also we're going to have to live with booster shots and get used to that as the normal. Thank you.
Premier, what's the rollout plan of the Pfizer vaccine for Indigenous communities in New South Wales? There's been some concerns voiced that jabs aren't getting out to some of these more vulnerable populations. What is the plan for people who live in those areas?
I'll get Dr. Charnel, Health Minister, to respond. But as you know, our Indigenous communities are especially vulnerable, and they were included in the first stage of the rollout. But I'll ask Dr. Champ. Yeah.
Look, it's been very pleasing that the Commonwealth Government has worked very closely with the Aboriginal community controlled, and New South Wales Health has also been engaging with the Aboriginal community controlled and looking at opportunities for rolling out vaccine through those services. Obviously, Aboriginal people access vaccines through a variety of different access points, and we would encourage everyone to go and on the eligibility checker and see if you can access the vaccine. But there is a lot of local work also to map where there are vulnerable communities, where there might be need to be in-reach models because of lack of workforce or access to primary care in those settings, including Aboriginal community controlled.
Nursing homes from people who live in those communities that people aren't able to keep up with the demand. There needs to be more resources. What are your thoughts on that?
Clearly we understand that healthcare is sometimes more challenging to access in remote and regional areas, and that's why we probably need to supplement those healthcare services by in-reach and mobile services that we go in and vaccinate a whole regional community. But all of those things are being extensively planned for. The current issue is largely that we don't have sufficient supplies of vaccine to meet the demand, but clearly we recognise the vulnerability of those communities and have it certainly front and centre as a priority for us.
Just on the nursing homes, because there's been another incursion into a nursing home of the virus. Do you take any solace in the fact that they're 90% vaccinated? The last time we saw a nursing home, incursion, there wasn't a catastrophic outbreak. The vaccine actually works in the nursing homes.
Can I just say first of all, every time there is a case that's infectious in a nursing home, it does send a shiver down my spine. I think we're all very aware of the vulnerability of residents in aged care facilities. But what it's pleasing to see is that in a highly vaccinated resident population, we haven't seen the outbreaks grow, and we're only just having the experience, but I think that's also mirrored in the experience in Melbourne as well. So that gives me great comfort, and it also does urge me to remind aged care workers that we're very keen for you to be vaccinated, because it's even greater protection if both the aged care workers and the residents are vaccinated. It reduces again the risk of transmission in that most vulnerable of settings.
Dr. Chair, these waiting lists that GPs have so that they don't waste any of their vaccine vials by the end of the week, should they be putting under 40s on that list for Pfizer? I know you said before it's a federal government thing, but they're asking for your advice.
So in terms of the Pfizer eligibility, there's a range of eligibility which addresses two sort of issues. One is underlying health conditions and age, but then there's also the nature of the workforce. So for instance, if you're an aged care worker who's 21, then obviously you'll get Pfizer. So there's two different issues. There's age cutoffs for the vaccine, but also special groups that we want to vaccinate, usually to protect the most vulnerable, such as aged care or quarantine workers.
Premier, can we just, on the restrictions?
Are you able to categorically rule out that there was no health advice to Crisis Cabinet to lock down earlier than was ultimately agreed to?
I can confirm that we provided the advice promptly around the lockdown when we saw that there were cases, unrecognised change of transmission in the community, and we realised that there was that extensive chain that was unrecognised that led us more broadly. We recommended a limited lockdown, which then lasted for 1 day, when we realised again that that would not work. And we recommended a full lockdown, and the government promptly implemented that lockdown, and we acted promptly to do that. And what we're committed to now is seeing the lockdown yield its effectiveness. And what I can urge the community to do is please stay safe this weekend, remain at home, and only go out for the most absolutely essential items.
But Dr. Chan, why is this about what could be done? You've got any advice yet about what further could be done, given just a moment ago you said more should be done?
Well, what I'm indicating is that I'm not pleased at the level of infections in the community, that we're not seeing that downturn, that we know that transmission appears to be ongoing. We need to interrupt the cycle, and that our mobility and other interactions are the basis for some of those cases. We therefore need to provide that advice to government, and as the Premier has said, the government will consider that and identify the most appropriate strategies that can be put in place in response to that data.
So how do you stop the mobility then? Because the other day, Dr. Chan, Premier, you did say this is a hard lockdown. You said it's not a soft lockdown, it's a hard lockdown. Considering those comments, how do you stop the mobility?
Well, that's why it's important for us to rely on the health data, which is telling us where the greatest rates of transmission are, and to make sure that any further restrictions really have the desired effect of getting down those numbers, especially the number of people that are presenting with the virus still in the community, and that is the challenge for us. But please know that every time Dr. Chant gives us proposals, we act within hours, as we did. That is really important for the community to know. New South Wales, to this point in time, has fared extremely well because we've relied on that expert health advice, and we will continue that. And I want the people of our great state to know that we will take whatever decision is required to have this lockdown go for as short a period of time as possible, and I want to make that very clear.
But nothing more that you can do right now to make that happen.
Well, obviously, if we have any concrete proposals which Dr. Chant and her team will present to us, we will take action in relation to that, and I want to make that very clear. And Dr. Chant has been saying for a number of days, as have I, that we are wanting that mobility to go down. We just need less movement, no matter where you are. Obviously, we know where the concentration of cases are, but what we do need is people just to stay at home, not leave unless they absolutely have to. And of course, if there's further things we need to do, we will, and we'll act on those quickly. Well, we also have to make sure that in New South Wales, we take decisions that are going to have the desired effect of getting those numbers down. Because I think the public would appreciate that any decision we take has to have that desired effect, and that's why we need to base it on the data. And as soon as we have concrete proposals on how we can further reduce those numbers, those restrictions, those issues which are still causing, in the last 24 hours, 29 people to have been infectious in the community for at least 2 days, that's what we need to target. And it's really important for us to continue to base our decisions on information, on data and the expert health advice.
But Premier, the data is showing and the science is showing that it's not spreading in retail settings. The only retail, it's not spreading in shops. So wouldn't shutting down retail just be pointless and cost jobs?
Well, that's the point. We need to make sure that firstly our priority is to keep the community safe. Can I please stress that? We go through various cycles of the pandemic. Our number one priority at the moment is keeping our citizens safe from the virus and making sure the virus doesn't spread. But of course, we also need to have a balanced approach to keep the community together and working with us, and that's been outstanding. I just want to thank everybody for that. But that's why it's really important to make sure that any additional measures, any other decisions we take for the community's safety are going to have that desired effect in those right areas of having those numbers go down. And that's why it's important for us to target further restrictions to where is required and to what is required.
Premier, restrictions in the regions due to end on July 30 as well?
Well, look, again, we're very pleased that the regions have remained virus-free, and we want to keep it that way. And that's why when we look at further if we look at further settings, we do need to make sure that we keep the regions virus-free. The regions have obviously some restrictions placed on them, but compared to other regional communities are still able to go about their daily business safely. And as Deputy Commissioner Warboy has highlighted, police will be out in force to make sure people don't try to get to the regions without those exceptional circumstances.
I think what you're hinting at then, sorry Premier, I think what you're hinting at there with the targeted restrictions is that we could potentially be targeting restrictions harder in those areas where there is greater spread, which is the southwest in Fairfield. So what would that look like? And is that, I guess, a balancing act to make sure that the rest of Sydney, where there isn't great community spread, isn't unnecessarily burdened?
Look, I don't want to foreshadow what specific decisions government will take until we actually have that specific advice to us, and that is really important. Sorry, is it the helicopter? Saved by the helicopter. Sorry, can you guys hear me? Yeah. I think I answered your question, Liz. I think I got your question. No, I don't want to preempt what decisions government will take, but please know that we'll take whatever decision is required to keep the community safe. Sorry about the noise. Sorry, who? Sorry.
Yeah. Can you hear me?
No.
Okay. Can you hear me? Premier, can I ask, as it stands now, New South Wales Parliament is due to sit the week after the lockdown is lifting, the lower house. Some regional MPs don't want to go back to Parliament, wanted to go virtually, but the message keeps coming back that your office is resistant to Parliament sitting virtually. Why is your office resistant of that?
I'm not sure what the question is about, I'm sorry.
Sorry, Premier, I'll repeat that.
Okay, sorry. What's the urgency? I didn't get that point.
As it stands currently, New South Wales Parliament is due to sit the week after the lockdown ends, first week of August. Some MPs, specific regional, don't want to come to Sydney. They wanted to sit virtually. However, the message keeps coming back that your office is resistant to Parliament sitting virtually. Is that the case?
Oh, look, I haven't had any specific proposals put to me about Parliament, and to be honest, that's the least of our worries at this point in time. What is important to us is keeping our community safe and making sure the virus doesn't spread further. But also, as Dr. Chant keeps saying, can we please issue a special warning for people not to increase their mobility over the weekend? We actually need mobility decreased. We actually need less movement. We actually need less people setting foot outside their homes. We know it's a very difficult period, but we just ask everybody to stick with the rules.
Premier, as you just said there, your main message throughout this whole time has been...
Sorry, I can't hear you.
As you just said there, your main message is for people to stay home. Surely if we close retail outlets like luxury handbag stores and places where you can go and buy shoes, which still remain open, these retail settings, it won't give people an incentive to go out, so that movement will reduce.
Well,
why is it not being closed?
As I've said, we need to make sure that any decisions we take will have the desired effect of reducing those numbers, and that's why we have to focus on the data. What the science is telling us and what the health experts are telling us is creating those extra cases of transmission and those extra numbers of people who are infectious in the community, and that's what we need to focus on.
People have nowhere to go.
2 doses of Pfizer and AstraZeneca gained 60% health. I don't know how that's happened. Are you aware of that case?
Sorry?
Are you aware of that case, and do you know how something like that could happen?
That he had 2 doses
of both vaccines.
2 doses of
Pfizer and AstraZeneca.
Okay. How old is he?
34.
Okay. 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 So clearly the issue is that in our mass vaccination clinics, we do rely on people to know, to read the information, and I think everyone would be clear that for both vaccines, you only need one of the vaccines and 2 doses. And so we would be asking people, whether they've had any other vaccines in the period, because one of the questions is you have to have a break between any other vaccines like influenza. So there are some standard questions asked. It may not have picked up this. Could I just encourage everyone to be very clear? You only need 2 doses of the one form of vaccine. There'll be exceptional circumstances where you've had a reaction to one of the vaccines and an alternate vaccine would be offered, but that will be under special circumstances. And I would encourage people to be aware of what vaccines they've had and make sure that they don't access those when they don't need to.
Just on some of those cases we've seen in healthcare settings and hospitals, like sometimes that's taken a couple of days to be confirmed or for that information to be released. Is that because you don't want to scare people about going to these facilities? Westmead, as an example, we asked about several days ago. It was not put out until 2 days later.
Look, just be reassured that we have very good controls on who's been in those facilities. As you know, we have QR codes going in. We've had those visitor restrictions, and the reason for those visitor restrictions in part means that there's a very limited number of people in those settings, which again makes it easier if we have an infectious case there. So our focus with these things is always to collect the information and respond, and then we'll release it in due course if it's got an impact. But we don't disclose every case where there might be an infectious person who's attended a clinic if there is no exposure to the broader community.
Dr. Charles, are you going to be changing your health advice to the Premier today?
So look, all the time we provide updated assessment of the situation. The Premier is very engaged in the numbers, the detail about every single case and where they live and what are the circumstances. We're looking at all of the different data sets to really inform what additional measures we need to take. I mean, clearly we've said this many infectious in the community is a concern, and just be assured that we're looking at all of the elements of the data to provide that advice.
So regarding paramedics, we had a very positive yesterday. We actually have numbers of how many paramedics are vaccinated. Look, majority, but no number.
Look, I'm not aware of that. Obviously, there's paramedics that come in and out of the system, and so those numbers sometimes can be at a fixed point in time. I know that there's been paramedics have been in the 1A category, and so have been.
So it should be 100% by now.
Well, they should, at any one point in time, because we always have new entrants, and whilst we do have that access, and some people may choose not to be vaccinated. We need to respect that at some point, but progressively, I think people are aware that the threat of COVID exists, and the vaccines are very effective at preventing hospitalisation and death.
Great, thank you.